redetermination, correct? Instead of an annual redetermination, some things.
Yeah, but they amended that out so that they would just, people on the waiver and other Medicaid services where it's easy to presume you're going to be eligible, and even if your income changes, that you would not lose your services while they're figuring that out and give you a chance to opt into maybe some other programs that protect your income.
Margaret, how far along is that bill, and is it going to make it to the finish line?
Well, it's only been heard in one committee, and so what we're hoping, and this is a rule for everyone to know, because I saw that Nicole and her bills that have died memo is probably assuming correctly that bills have died, but if you have a bill that's heard in one committee, it can be amended onto a germane bill when it's on the floor. So I'm hoping that similar language could be added to the ACA bill or a DCF eligibility bill that's very similar to what Chair Tremont has done in his bill. And
So
other
we're racing
states
to the
do
finish
it.
line.
It's not unusual. Other states do it. So the other thing, I'm working with Melissa to try to get some money to get some support coordinators and other staff that are there when I don't even think we're able to serve people in crisis, truthfully. And we've got to have support coordination, personal supports, and probably behavioral techs available. So we're hoping that we could get this language in the Senate so that we can have that. And then also we're trying to add more money into Transportation Disadvantage Trust Fund in their innovation grant for people who need paratransit transportation throughout the state. And there's some programs who have done a lot of good work who wouldn't be able to serve clients anymore. So we're working on that.
Well, Margaret, you've been in this field for a long time, and how would you say this legislative environment may be being impacted by some of the unknowns coming out of Washington with administrators for community living and concerns about Medicaid, national huge cuts? Are you hearing that rumbling into conversations? Is it creating an inability to make commitments, move forward?
No, I have not seen that. Because I listened to Chair Andrade, for example, who's head of the Healthcare Budget Committee, and he's so interested in getting people off the waiting list, even up to Category 6. And you don't talk like that if you're worried about a commitment for Medicaid.
But
So
would you say along that line, Margaret, that the legislative awareness and commitment to developmental disabilities has improved markedly?
more people have children or know somebody that has a developmental disability, the 1 in 36 chance of having a child with autism is real, and we're just we need to make accommodations and modifications in how we do things to include everybody.
Then can you speak for a minute about Department of Education and the whole VR blind services transition that kind of got carved out? Did it go back to limbo land, or that all died, or kind of where is that all heading with the federal executive order?
Hearing it's definitely dead this session, and I don't think there's momentum to move that forward at this time, especially because I think they're trying to figure out what to do with the agency for persons with disabilities, let alone combine it with both rehab and blind services.
And any other good jewels you want to share before I go to Nicole?
Well, I noticed in the House budget that they allocated 31 million for the pilot program and 31 million for the regular iBudget program. But you'll notice in the Senate that they haven't allocated any money, but they have something called back of the bill money, where a lot of money is going to be coming back that they couldn't spend this year. So I think instead of asking for more money, they're going to be reusing money they got last year. But I'm just wondering why the House is the House didn't look at it that way. So I'm paying attention to how they're going to allocate the funds. If they're going to use the ones last year or both even. Alan may have insight into that. But
Alan, you in there?
Yeah, I'm not sure how they plan on using that money. They are aware of it, and it's been talked about a lot. And I think there's a lot of discussions going on about it. So I'm really not sure what's going to happen. I believe the Senate didn't put it in their budget only because they're letting the House take the lead on disabilities and the wait list, just because that's a priority of theirs that they've talked about. And so they basically just put it as a placeholder. I anticipate that we're going to take off even more people from the wait list that's listed. The way they wrote it now, it's kind of split into two, with half going to the managed care and half going to the I budget. That seems to be dependent on the bill that got taken over that used to be the APD bill. And I think Stephanie took it over and commandeered it. But I think that is kind of in line with that. But I'm not going to be surprised if a huge number of people are taken off the wait list. You know, it's interesting, at their committee meeting, APD talks about $350 million that is that was not spent. It was not used. And one of the representatives asked, well, isn't that more? Because if you'd have spent it, you would have gotten more money with the match, and it would have equaled like $850 million. But they don't talk about that. There's got to be a realization that if you don't use the money, you're not just using that money. You're not also using the federal match, which is more than half of the money that we use for the I budget waiver. But it's going to be next week by Wednesday. I think we'll have a lot more stuff, and then I think next weekend the legislature will probably even stay over the weekend and have those meetings where half the committee is a senator and half the committee is a representative. And that's how they kind of work out the differences in budget, because they have to be identical at the end of the day.
So then, Nicole, what do you got from your action-packed week and all the work you did?
Well, it was mentioned, I went up to Tallahassee on Tuesday. I was asked to participate in a speak out event at the Capitol, and it happened to coincide with World Autism Awareness Day. So it actually worked out pretty well, I think. So while I was up there, I tried to fit in as much as I possibly could for meetings, like just ran all over the place to see people. So I will say that probably I didn't get a chance to do much running down for APD. I think Alan and Margaret definitely, and Melissa have that amply covered. I would admit to some confusion when I look at the budgets between the House and the Senate and then the bill analysis. It's a little confusing to me because I don't always see the money reflected in what the speech is when they discuss it on the floor. But other than that, I know that there's going to be a lot of attention on these moving forward. So I think we're going to get, like Alan said, a lot more clarity probably next week and the week after. For the cameras and classroom, I had a meeting specifically about that with Senator Simon's aides, and then I tried to go to a meeting with the Attorney General, and that didn't work out so well because I wanted to ask about the 504 Texas versus Becerra case, and but I did get an updated statement, but the statement that I got still isn't accurate. So, but I did get the contact information for the Assistant Attorney General, so I got like a direct email, and maybe we can discuss that with them. Stephanie mentioned, I think Tom mentioned that on the One Voice Brevard Facebook page, I try to do like daily updates of what's going to be, in the calendar. So if you go to the Facebook page, One Voice Brevard, and I'll put a link for that in the chat, but in the morning, I'll tell you if I see it, and it's not always like I miss stuff, so I'll be the first to tell you. I'm still pretty new with this, but if I see something that looks like it might be related to IDD on the schedule, I put it out there on the page first thing in the morning, and then I do a recap at the end of the day where I talk about if the bills were found favorable, what was the vote, if they move forward or not. I have a tracker that kind of, you can't really see because I have blur on, but it looks like that. And I check this thing like every day. And then at the end of the week, I do a recount. So kind of a recap of everything that was done during the week. And I'm looking to see what's moving, what's not, what amendments were added, what bill analysis was, added, or any of those kind of things. And I try to bump that with the budgets that have been published to see if there's consistencies or inconsistencies. So that's just something that I put together there. And as Margaret mentioned, I did a little slide, or not a slide, but like a picture, a graphic about the bills that I called dead. And Margaret is absolutely right that this is subject to change, and it's certainly not an end all be all. And I'll put this in the chat here so you can take a look. And again, it's also subject to like, I don't remember, somebody told me over 1,000, surely close to maybe 2,000 bills floating around between the House and the Senate this session. So from the scrub, and I've been trying to catch this from the very beginning, once the bills started getting filed, to do a tracker of all the things that are moving around. So that's the information that I put out there. I'll show you also the recap so you guys can take a look at that and see what that looks like. And then I'll also put the link for the Facebook group. And if you have any questions, just let me know. I think we'll go
Thank
back
you,
to
Nicole. That was
Tom
great.
again.
And then we have entering and signing in, please, Miss Stephanie.
Hello. Happy Friday. I don't know what I missed, so I've kind of got a little bit of beat.
We did our around the clock, around the house kind of updates from Melissa Allen, Dino, Anna.
Guy, there's Joe McCann from
Hey,
Family.
Steph, why are you so tired?
Quit it.
Well, we were
I'm
working. We were
so
working.
tired, Joe. It's been a heavy week.
I
I've
know.
actually had a lot of families reach out for help in getting access to the wait list. Several families denied just for the wait list. Families that are in crisis. One of our families is in crisis for over 140 days. And his son was Baker acted for the last 20 days, and it took a lot of legislative contacts. The good news is he has now been accepted under crisis priority 1, which is wonderful. And that's one, and this is so systemic because we don't have the crisis supports. And there's 3 of my families that were told by the APD that, the delay is caused and a lack of psychological psychological evaluators, which was then confirmed back that there is not a lack of psychological evaluate. Like, there's just been a lot of squishy talk from the agency, and I'm normally a different kind of energy. It's just been really heavy. There's one family in particular that has 2, and it's just like my family walking through this, where where it's just outright denied for the wait list. Mom did everything right, sent everything accurately, followed up, professional in her own crisis, and is now needing some psychiatric retreat because her son was denied again. And I don't even know how to articulate. It's just, we know there's so many families out there that systemically are unable to get the care they need, and what that does to the whole family. Everybody loses there. I've spent a lot of time with providers, a lot of speech providers, a lot of behavior providers, a lot of especially behaviors, because our behavioral providers had the switch, whether they're waiver providers or not. If they were fee-for-service Medicaid providers, they are now going through the managed care switch. And the managed care companies are not credentialing them, so they have had to disenroll their, their clients, their people. And then those families, the disenrolled kids, have called a lot because they're in crisis because their kids are regressing, and it just feels so freaking heavy. But I'll come with some good news. I'm gonna try to muster it up here. I was on mute in the beginning of the call because Representative Mello had a meeting with the agency this week, and I have been very active about these families, which are constituents of hers, to get them help. And so she was able to move 6 of them, and called to report back on um, her frustration with the crisis. And I'm still downloading the information she just left with me, but whew, she asked me, Stephanie, is it true that children with autism don't get that diagnosis until they're 4 or 5? What? Like, no. And that is what she is being told. Um, and that is really, really, difficult for me to even like, no, not that. So that's what I have there. I did want to shift off of me because I feel flustery and move to Jeff because I saw you on TV this week, sir. Did
Fabulous, Jeff.
really stinking awesome job this week in Tallahassee. And I was hoping you'd share.
Oh yeah, sure. First, it's so frustrating to listen to this stuff because I can remember going through it so many years ago. Gets me emotional still. If nothing else, I just felt like I was just trying to do my part and just try to communicate what life is like for any of us that have these kind of situations, and just wanted them to try to put themselves in that position as they're making decisions going forward. And Fino was nice about it, but I'll be more direct. That managed care sucks. It is terrible. In my prior life, I was involved in that on the healthcare side. So I know all the things that are promised, and they'll say anything or do anything. And it's all about deny, deny, deny until you have to pay. And it's so that's why I wanted to add in there too, because it is not something I know they're trying to think of answers to try to get people off the waiting list, but I don't think that's the right answer. I think if you just get people that actually know what they're doing and care about what they're doing, it could make it work. But managed care is not the answer, and that's so I would hate to see that be a solution for somebody. But I'll do it again anytime I can. It makes me feel better that I'm at least trying. So that was my 2 cents.
That's a fabulous 2 cents. I know that you did that on the flip of a flip of a moment so that they could hear from a family, and I don't know, I can't think of a better one. I remember you saying, I saw that managed care is optional. So appreciate that. Let's keep that in mind. Families want it to be optional.
Yeah.
And Woohoo. That is, that's kind of it. That's like our mission here is how can we elevate our stories and our voice to our legislators when and where we can. Not all of us. I know, I wanted to be there this week, but that was not going to happen in my world. So really, really appreciate you doing that. I don't know, Nicole, did you talk that you also flipped on a dime to get to Tallahassee?
We talked a little bit about it, yeah.
Yeah, the majority of us can't do that, and that's totally okay. If you can, though, if you are able to come to speak at some of these hearings, and I don't know what we've got left. Purposely, like I'm a little lost in the weeds. Uh, I we're taking names and numbers. Melissa's got a call list, and she's trying to get families to really present their stories.
I just wanted to interject. I'm sorry, real quick, when
go
you're
for it.
talking about that, but we have, there's money that has been raised for anybody who does want to travel to Tallahassee and engage in the legislative process. And, like I had said earlier, Doug told me that he really didn't think that the APD bills were gonna be this week, but the following week on the 15th, that they will be heard, but we do have money. It is at the ARC, and if you're interested, if you email Alan and myself, then we would run it by the committee, and
As
we're
soon as
trying
you
to
have
do
the
it.
date on that hearing, if you can share that, then some of us will rally and get ourselves back up there.
I'm sorry, what did you say? To have the what, Tom?
Do you have the exact date of the hearing when that's been
Oh,
finalized?
yep.
And then
Yeah,
folks will know, and we'll, spread it far and wide and get some folks to be there. Okay.
Tuesday, April 15th is the Senate one is at 8:30 and the House is at 1 o'clock. But one of the things that I wanted to tell you guys about was on Wednesday, the budget had in the House, they had their big meeting, Chair Lawrence McClure, it's his committee. And they had that, I think it was in the morning. And toward the end of it, I listened to the end of it. They were really unhappy with the state agencies and the lack of transparency and the lack of accountability when it has come to the money, not just APD. The Department of Corrections has, had been given millions of dollars, a couple of years ago to build a mental health facility, for people that are in jail that really shouldn't be in jail. And it still hasn't even been built. So they were very upset. All of them, it sounded like they were each just chiming in. I guess one of the things that the speaker has done this year is when it comes to these particular committees, they really want to focus on, legislation that was passed, before. Has it been effective? What's going on with the money? Doing a deeper dive. So some of these committees have actually broken out into work groups for each of the particular state agencies so that they can actually do a deeper dive on those agencies and the goings on. And they were not they really were not happy. And they were talking about, like, even if they need to use subpoena power, that they will do it. And also, like, hope project that the lady has, that's been in the news this week. There's an issue with some transparency with that program, that they're not getting all the information that they want. But that, I'm sorry,
What program? Sorry, I think you broke up. Like,
oh, the hope initiative, pathway to prosperity, that particular program, because now there's a bill out to, I think there's to codify the hope program and to have it as part of the executive office. And apparently there's like 125 hope navigators within all of the state agencies. And there's just it's just not clear exactly, like, the money that has been distributed to church who have contributed, like, where's that money coming from? There's just a lot of questions. I was reading an article about it this morning that somebody had forwarded it to me. But anyhow,
Put it in the chat, Melissa. So if people wanted to actually read it, they're talking
Okay.
about the fact that the charity is not complying with state laws. So that's it's in the chat.
Yeah, but that meeting on Wednesday, Lawrence McClure, he's the chair of I think it's the House Appropriations Committee, Budget Committee, I'm sorry. And it was the last part of that meeting that I actually got to listen to was not, it wasn't too good. Like, hearing what they're saying about those state agencies and what they're looking to do. And they really want to get to the bottom of what's going on with the money and the policies and all that stuff. And so I'm glad to see that they're doing it. It's good, but it's definitely interesting to listen to and to see that process.
Me too. I did hear the discussion with Hope Florida is one to pay attention to next week. So I'm gonna take that advice. I had read, I don't even remember. This was a couple days ago. I read the Hope Florida bills out there, and there is like some discrepancies in which agencies are in it, and in an analysis, APD was in there, but not in the actual bill, and not on the other side of the bill. And so I had expressed, you know, we have a lot of families that have experiences with Hope Florida, and they haven't been reported to actually come back with any hope. So I shared that, what families have shared about the program, and I hope to see that there will be, 10,000 calls is what the agency said that they had done with outreach, and, some measurable outcomes with that. I would love to know. I think Hope Florida could be a really cool thing. It would be a really incredible thing. It's just we got to make sure
Also
that
curious about their appropriation because that hasn't really been
right.
discussed
Yeah.
yet.
Well, I
So.
know they got one last year.
But what did they do with it?
Right.
What impact did they make?
What do
How
they do
much
with it?
hope was brought? And so, I love the theme. I love the marketing of it, but I don't like the impact of it. And if we really want to make a difference, hope is a terrible, terrible thing to give without actually delivering.
Yeah.
Yeah, they talked about in committee about how many phone calls they've made and how many letters
10,000.
sent out, and I'm like, I'm not in Brevard County, at least I've not seen any of that. So I don't know. I'm hoping, like you said, we'll see what happens next week when they start to dig into this a bit more. But I looked at the bill analysis for it, and I'm still not seeing. It's still not very clear. So we'll see. But next week.
I got an interesting call last week from one of our local APD leadership for Area 4. And she had texted me after hours asking if I would call her when I had a chance, because she had been on the phone with a family for over an hour. And she said that she didn't think Hope Navigators would be of any use. And so her only thought was that she would send them to me.
What?
Yeah.
Uh,
You said that was somebody from APD that called you
Yes.
and said that didn't think that what was calling about, like people that were trying to get services at APD?
I think
You want
the
hope, not a
son
joke.
is on, the son's on the spectrum. Adult son on the spectrum, mom can't work, and APD will not help them, and there's nothing she can do for them, and Hope Navigators will not be of any help to them. So the only thing she thought of was that she will send them to me, and hope that I can at least give them maybe something. Which, of course I will do, but I've spent so much time on the phone with families all week long. I mean, I was in a 2-day training. I think I sat in that training for maybe a half of the time, a training that I set up, because I spent all that time on the phone with families calling left and right all week long. And one of them I did send over to, I texted Stephanie, who was busy, so I didn't bother her much on it, but I was actually able to get that family emergency access back to Medicaid, because they dropped her from Medicaid, and this girl was literally, I mean, she would have died if she hadn't regained access today. She's completely dependent on medications, oxygen, 24/7 nursing. Her life depends on it, and they dropped her from Medicaid. So it was, the sibling still doesn't have Medicaid right now, but at least she does for today. I
And
don't know.
just
It's
Anna, real quick, and anybody else on this call, if you have anybody that is dropped from Medicaid, filing a fair hearing request with DCF is, there's a spot on it before you submit that form to be able to continue benefits while the fair hearing.
That's exactly what we
Okay.
did. And the first thing I had her do, I was like, look, the only time they respond is when you file a complaint with ACA, because it was the middle of the day yesterday when she called me, which of course you can't get through to any lines. So she couldn't get through. So I was like, file a complaint with ACA and someone will call you right away. And that is what happened. She still couldn't get through. So I had her call first thing this morning so she could actually get on the phone with the appeals people. And she was able to get through. And when I spoke to her this afternoon, her daughter's Medicaid had been put back. But it does turn out there's another way forward as well. If this does happen, it's down there, buddy. If you're in that situation where it's life and death, you can go to any public hospital and have the healthcare provider put in an emergency Medicaid, and you can be hospitalized and receive coverage as they're navigating, figuring out, reestablishing services. So I didn't know that existed. I just got that info today. But you know, with the way things are going, I think that's information we should all know.
Most certainly. You said something, conference. You said something that reminded me of last week why we didn't have a meeting is because Joe McCann, and I think they're off the line because they're getting ready for the Family Cafe Let's Talk. He came down to Southwest Florida and did a workshop with families at our local university on basically what we do here, but really helped connect dots for families on how they could use their voice to share their stories, and get their families help. And he's not here, so I'm just going to offer it from him. He did say this, but if you would like to have Family Cafe Joe McCann come into your neck of the woods, give him a call or an email. It was incredible. Not only for the families, but also for our local college, because this gives insight on how that now they want to come alongside and help more people and broaden it. And that's when I think of Hope Florida, those are the things I think of. But Joe, but he knows how, he's a dad. He knows how to talk parent to parents, and he's been doing this for like 30 years. Absolutely an incredible workshop that we had. So I wanted to make sure that I said that because, but when Melissa initially came up with hey, we need to get the families involved, the concept was, let's all do this in our 67 counties across Florida. And this is how we do it realistically on a weekly basis. But to be able to connect locally, and have and
I don't have
have
any more buttons.
and have the advocacy piece involved, that would really, really, what do you call it? Like further our impact. And I'm so tired that I don't know how to give the energy that I want to this, but there's no time like now. This is the time for every single one of us in whatever capacity to share our stories, to get that out. And that's not just for purposes of the legislative session. Like this is a right now, right here fight from where I sit all the way to Washington, D.C. And these stories need to be told so that our loved ones get what they need. I want to make sure that I say, because I don't know if we said it, but at 4:00, Family Cafe does their legislative Let's Talk session, where policy experts come in and they really give the high level information of what's happening with bills in Tallahassee. And I want to make sure we give enough time to have for us to all hop off this and hop on that.
With that in mind, can I say something real quick?
And
Just
yeah,
Just a
and
quick, just a
oh,
quick reminder that Medicaid is a federal program and a state combination partnership. So reach out to your federal senators, representatives, tell them how important Medicaid is to you and your family, and make those phone calls. We're getting more than 1,000 a day from people. So be one of them.
Yes, and connecting the dots with that in mind, everybody save the date for October 3rd. And Joe McCann is actually on my short list for keynote speakers. So any other suggestions for keynote speakers, please send them to me.
Margaret Hooper. I think
She's on my short list too.
yeah, she's on my list.
They're just gonna have her nominated to go all the way around the state.
We'll just not get everybody to go around. I want to open up discussion for the next like 5 minutes. You talk about whatever you want, but just so that we get off by 4 so we can hop on that next one. Anybody, everyone, any talk? Hey, I turned 40 this week, and we're gonna go off script here. I am 40 years old. My son told me when he could talk, Eli, my third kid, that like I think he was less than 2. Don't worry, mommy, you're not old yet. You don't turn old until you're 40, and then your face caves in. So
I thought
now
it was
Well,
70.
yeah,
yeah,
well,
your face isn't caved in though. What happened?
yeah, and Collier
I'm 1 year
telling
behind
me I'm
you.
like 2 years old, like everybody
Yeah.
around me, and I'm like, so now it's a daily joke, like, hey, how's my face doing today, kid? But yeah, what else? What's going on in your neck of the woods?
I
Somebody,
think my birthday is the day after yours.
you're the 31st?
Oh, I'm the April 1st, so I'm 2 days after you. Yeah, so I turned 39.
Definitely an Aries, though. That makes a lot of
Oh,
sense.
yeah, you and I.
The redheaded Aries.
Redheaded
Yes.
Aries. Yeah, we're a wild bunch.
The first time I met her, I was like, "Oh, you have red hair too. That explains so much."
Every time I meet a redhead, I'm like, oh, we're safe here. No one else is, but we're good. Well, you guys have anything else you want to add? Nicole, Tom, Fino, Anna, Jeff, Paul, Russell, and Deanna. Is that
Oh,
Deanna?
you know what?
Tomorrow's pillow
Has
fight day.
anybody? I've heard some, and I haven't. Again, like I've got a lot going on, so I haven't read through. But I heard there was some recent push with is the new APD bill the newest version? Does that exclude pediatric? Does it exclude under 18?
I know not what you're referencing.
So
You're
the
shaking your
AP,
head.
You mean for the managed care pilot?
yes, and we're
Yeah,
not
that's
managed
18
care.
above.
The for so the managed care should exclude, right? That's always excluded under 18. Now, somebody had said something along the lines of they thought they were pushing to exclude under 18 from the med waiver, which I hadn't heard, and I
Nope.
figured I'd ask.
Well, that's happening in your community all the time.
Well, yes, of course, but at least we can still technically get on in,
No, in
as long as
fact,
you don't get on an area 4.
But if you look at our wait list, that's clearly the case. There's over 10,000 people that should be on the waiver that are sitting walling in the,
Oh, they're all getting denied. We
you're
have people
eligible
being
at
denied
the
right
age of 3.
now that are 100% eligible, and they're all being denied pre-enrollment. So it's a huge issue in our area right now. I was on the phone with ArcJax before this meeting, and they've had case after case after case after case. And I mean, they've helped them with every step of the application. Everything is correct. Everything meets all of the administrative code. The denials are, I mean, and to be honest, we're thinking that they're not even looking at the applications. They're just denying. And I don't think that they're actually making their way to Tallahassee, which is really concerning considering what we're being told in family care council meetings is the eligibility is being determined in Tallahassee, not in area 4, but that's obviously not the case.
we
So
had a letter that said that the evaluations were a benchmark, but could not predict the future. And since we couldn't predict that if this was going to be a lifetime disability, we would have to wait and see until they turned 5 to decide if they even had autism, even though they
Stephanie told
had
me that.
3 clinical
Well,
reports on that.
no, I told you about the 5-year-old that so that was 4.5 to 5, and then I had a
Uh-huh.
5-year-old that was verbally told, not through email like this, but that their kid grew out of autism. So,
Oh, that's my
hang
favorite.
tight, just hang tight, it could happen. Like,
A
oh,
miracle.
Well, let me introduce you to my kid who's literally destroying the peer right now, who never grew out of autism.
yeah, yeah. So I think that Nicole is really on to something with getting the definition straight, getting the understanding that you don't have to wait until 4 or 5 to be diagnosed. In fact, it's
It should
widely
be done at
known,
18 months.
and it's very widely
And
known
this,
that that's the best preventative measures for
Being
long-term.
like early step. What a concept.
Yeah.
Oh, wow.
oh,
Great deal.
and
Erica, wait, Erica raised her hand. She put it down. She raised it again, and we only have 2
sorry.
minutes. I want to give her a chance.
No, it's okay. I think you answered my question. Thank
Oh,
you.
okay. We got to get loud in this group at the end.
Pop it.
We're all mouthy.
It's family.
Yeah, well, have you guys seen the research out of the Marcus Center on, those early signs of autism that have everything to do with eye movement? Because when my son was a baby, I would look up autism all the time, and it was based on the way he looked at things. And that was my intuition, the way he looked at things. Something told me, I had a gut instinct. And come to find out years later, that research existed years before my son was born, but I didn't know about it.
Yep. I think that autism bill, Senate Bill 112, and having a huge research hub out of the University of Florida will really help bring some more information forward. And I do, like, before we get off, it is Autism Acceptance Month. We've moved from awareness, everybody knows, to acceptance. The national number is 1 in 36, but actually in Florida, it is 1 in 18. So that is an interesting a new fact for me, but it's on Department of Health since 2022. I just didn't know about it. But with that thought, let's do this again next Friday at 3:00, same spot. We talk on Facebook in between. Let's go see Joe McCann in the Family Cafe. Bye, guys.
See y'all in a minute.
Thank you, Ken.